The SPG block, or sphenopalatine ganglion block, has been used for the treatment of migraine and cluster headaches for decades. This video provides a brief description of how to perform this procedure at home.
Hello, I'm Dr. Morris Maizels. The SPG block, or sphenopalatine ganglion block, has been used for the treatment of migraine and cluster headache for decades. My group published the first scientific study of its effectiveness for migraine headaches in 1996. I've treated thousands of individuals successfully with this technique over more than 25 years. And I'd like to share the technique that our patients use at home. First, a brief look at the anatomy. The SPG is this large nerve in the back of the nostril, underneath the nasal mucosa, on the outside or lateral wall of the nose. It is involved in transmitting brain signals that cause a migraine. We are wanting the lidocaine to reach back to this nerve center.
You will need a bottle of viscous lidocaine, 2%. You will need a prescription for this, a 1 milliliter syringe without a needle, and a small cup. First, squeeze out a little more than 1 milliliter of the viscous lidocaine into the cup. Draw the lidocaine up so that the syringe is full. There will likely be some air bubbles. Don't worry about that. The proper position is the key to success. This video shows one person doing the procedure for herself. It may be easier to have a second person available to insert the syringe and inject the lidocaine. You'll want to lie down on a flat surface, usually a bed with 1 or 2 pillows. You will lie down, curled up on your side like a baby. The shoulder rests on the back of the pillow and the head is off the pillow, touching the bed. Turn your head so it is rotated at about 45 degrees. The idea is for the medicine to travel by gravity along the outer wall of the nose to the back of the nose. If the headache is only on one side, lie down on that side. If the headache is on both sides, you will be turning and treating both sides. Insert the tip of the syringe as far as it will comfortably go into the nostril that is down, pointed towards the outside wall of the nostril. Inject all of the contents of the syringe. Sniff sharply so that you feel it towards the back of the nostril. You might feel some burning in the nose or numbness around the eye. A good indicator that the lidocaine has reached the ganglion is a tear coming from the eye. Stay in this position for at least 2 minutes. If the headache is strictly on one side, you may sit up. If the headache is on both sides, you will roll to the opposite side and repeat the procedure, again staying down for 2 minutes. When you roll, try to keep your head down in contact with the bed. If your head comes up, the lidocaine may drip out or go down your throat. You may sit up after 2 minutes. You might feel better as soon as you sit up. For some people, it takes 5 to 10 minutes. Lidocaine treatment might completely stop the headache, but sometimes the headache comes back and the treatment may be repeated. The treatment may be repeated up to 4 times in one day, but check with your physician about how often they feel it is safe to use. When you sit up, if the lidocaine has gone into your throat, you may feel numbness and a bitter taste. If that happens, you should not eat or drink until your sensation is normal again. Physicians, please see the link below for information on how to prescribe viscous lidocaine and for a patient handout. This procedure requires a physician's prescription and has not been evaluated by the FDA for safety or effectiveness.